Welcome to the HealthSpark, igniting healthcare management change and evolution. I'm your host, Dr. Raya.
Hi, I'm Dr. Raya with the HealthSpark, and today we're here to talk to Peyton Fry. Welcome, Peyton.
Hey, nice to be here.
So I'm going to read Peyton's extensive biography, and I'm going to try to abbreviate it. You're welcome to read all about it and learn more about it from his URLs in the bio description. But Peyton is the founder and the owner of Glass Raven. It's a healthcare consulting and analytics firm specializing in patient access optimization. Glass, with a focus on bridging the gap between healthcare operations and digital tools, he helps organizations leverage data to drive transformation in referral management, call center efficiency, and clinic capacity utilization. Payne earned his Master's of Health Administration following his Bachelor's of Science in Biomedical Sciences from Texas A&M University. So his expertise lies in translating executive priorities into practical data-driven strategies that improve patient access in healthcare delivery with appropriate digital footprints. So again, welcome, Payne. Thank you so much for joining us.
Yeah, thanks, Ginger. Glad to be here.
So we are going to start with the first question, which I was super fascinated about, but tell us a little bit about your journey and how you got here today with Glass Raven.
Yeah, so I'm about to say before my MHA, I actually started on a pre-veterinary medicine path. And so I thought I was all about animals and all about, clinical work there. And it turns out that I discovered too late to my program that clinical medicine is not for me. And whenever I ended up shadowing in clinics, I ended up in the office instead of the, surgery room, and decided that I would just pivot into my MHA to, take more advantage of, knowing that clinical operations, are often driven by those back end pieces to make sure that everything runs. And I decided that's just where I wanted to do that work. So got my MHA and then rolled from there into my first job at Houston Methodist in the Texas Medical Center, and started working there. Kind of the first job role was focused on their ACO, their accountable care organization, and how we do outpatient operations to really close gaps for care, comply with CMS, and importantly make sure that it's a financially healthy operation. And I knew my way around Excel at the time more than the average bear, and was constantly be assigned like, do this data project, do that data project. And it was kind of a lot of one-offs. And it was what I found, it was like, it's really hard to get data in the right hands at the right time, just doing basic, Excel out of the box. And it's like, we need to get information to providers on Monday for the patients they're going to see on Monday. And, it's like the report's not available until Sunday, so we can't get it to them physically fast enough, just kind of doing it one at a time. So I started kind of just building tools that worked for me, and then evolved them into things that worked for providers and MAs and front desk staff so that they could do it on Monday, and not wait until Wednesday to get those reports. And it really just kind of opened up this box of, like, if we can make the tool simple enough for, these frontline clinical staff to use, we don't miss 2 days of work. And we ask everyone for their fall screening that needs to be, because it was an organization where, we had a Medicare population, commercial operation. So it was very unclear what we needed to do for every patient. But it was that opportunity space to really, early in my career, use data to make meaningful outcomes for the ACO and track those tools very clearly in the dashboard. But, the focus wasn't the dashboard, the focus was the tool. This is how you close the gap on all of these different pieces, see numbers improve over that.
Okay. And I was going to ask, I did forget to ask, like, what kind of data were you trying to give the providers so they can make the best decisions possible? Like, what are you talking about to give the listeners some perspective?
Yeah, so at the time, it was like, this is your patient list for the week. These are your Medicare patients. These are the care gaps for CMS that we haven't fulfilled yet. So like, these are your diabetics. Check on their HbA1c every time. These are the patients that you just haven't done the fall screening or the depression screening yet. Do this once per year and we'll be good to go. It's like you're getting to October, November. We've got a little bit extra time on our hands. Maybe we've got front desk staff that aren't doing something. Here are the things that we can close over the phone. So like, let's not take a whole patient visit for a fall screening. Call these people and get it in. So it was a lot of, action-oriented data points for do these things at the right time while we have the patient. So let's not interrupt the patient. Let's not interrupt the provider. Let's get it done and in the system and then move on to, the next cost saving or revenue generating opportunity.
Love it. Okay, I love it. Okay, so then how do you end up with Glass Raven?
Yeah, so Glass Raven evolved because I had to move. I built a lot of tools for Houston, and it was like it reached a point where I don't think IT understood what I was building. And it wasn't really being followed that, there were databases and Power BI reports and data pipelines and things that I was doing manually and some of it automated. And it was like I turned it into a data engineering role, from my analyst position that then became very hard to backfill. And so I was moving to California with COVID, and my partner had gotten a residency at Stanford. And so I was moving with them. And at the time, Houston didn't have an opportunity for remote work from California because of labor laws and some other complicated things that California throws up.
Mhm.
And they said, could you open up an LLC so we could pay you as a contractor?
Oh,
And I said, sure. Does that prevent me from working with other organizations if they're, having these same problems or if those opportunities present themselves? And they said, I don't think we can stop you. We would love for you to have those opportunities. So they, kind of opened at my employer's behest to hold on to those old job duties. They ended up introducing me to a lot of my original clients. But kind of a fun way I had promised myself I would never go into consulting, and then I did. Because I had found that, if we automate and scale tools, I had the bandwidth to take on more.
mm,
And found that, we could advance analytics so fast that it, outpaced adoption.
yeah.
Just,
And everything that you described to me, it sounds like that's not just the job of the physician, but it sounds like that was a lot of things that the team itself, the interprofessional team itself, could be helping the physician with, right?
yes.
To ease the burden for the patient.
Yeah, the entire office, like, that ACO project is one of my favorite projects because it was so many people used that tool. It was used, for them to look at, the population financial health of the organization and expect what sort of reimbursements or star ratings they were going to get. And then it was used, and I would get emails from MAs like, hey, like it's Monday at 9 a.m. and I haven't gotten the reports. Patients are walking in.
Uh,
And it was so interesting to see all of these different offices, use the tools with, different individuals wanting different levels of granularity, but all using the same tool so they, could talk about it with each other.
mhm.
And it wasn't just an executive dashboard. It wasn't just something for MAs locked in an Epic dashboard. It was a very global tool that people could speak to.
Wow. Okay, great. All right, so I'll keep going, but let me ask you the next question and then we'll keep drilling down. So you built Glass Raven into a resource for healthcare organizations to improve decision-making and optimization processes. So can you walk us through how this works? I mean, you kind of start to do this, but is it independent? Like, does it have to be integrated into the EMR? Like, how would somebody actually use it?
Yeah, so the EMR integration is not required.
Okay.
But I say it's an option, but a lot of times that becomes very complicated very quickly. And not all EMRs are created equal, and none of them are built the same.
Mhm.
It's actually a trap a lot of product-based companies can fall into.
Okay.
Is that we're going to build for Epic or we're going to build for ECW, and then we go to the next client and nothing works. Like these HL7 message types don't exist. We've got all of these other problems and security compliance. So oftentimes you can start with an Excel-based solution.
Wow.
For some people, a pivot table is better
Mm.
than what they have today. You don't have to go all the way to Tableau or BI. You certainly can. That might be the goal once you know exactly what your decisions are and you want it all automated, but baby step in. But I consider us a very service-based company because we're not trying to fit a healthcare system's problem to our solution, and kind of, retool their problem. We kind of go in expecting that we're going to have to reinvent parts of the wheel because everyone's got a different payer mix. Everyone's got different financial targets or, resources they can throw at a problem. it's got to be built for them. So really starting with what decisions can someone make before we start trying to design the solution around that to make the decisions very easy to arrive at.
Hmm. Okay. And I mentioned to you, part of my concern is very much for, like smaller entities outside of big healthcare systems. And how do we protect somebody like an independent physician, or maybe a smaller healthcare system in like a rural community? And how would Glass Raven be able to ease their burdens differently?
Yeah, so there it's for groups like that that I think the service-based focus really is important. And also kind of what I just talked about is you don't have to jump to the big platform-based tools to solve a problem.
Yeah.
But as a clinical providers, and then front desk staff, the medical coder, these people know what needs to be done in their operation, and they often might just need more time. So, even little things like, hey, we're just going to make Excel do the work for you. We're going to do a simple report. We're actually going to get rid of a bunch of things that are not creating outcomes.
Mm.
I have a constant campaign for my career against what I call fun fact dashboards and fun fact reporting, which is just, asking questions to ask questions. And when it's not related to decisions,
Mm.
and saying like, hey, we're not going to pursue a lot of this work that doesn't center around an outcome we're looking for. We're not going to make 1,000 metrics. We're going to make 3, and these are going to be the 3 things that we do for a year. Because leaders need to spend their time coaching and working on processes rather than trying to remember 1,000 things.
Right.
Really kind of helping people narrow down their focus to make meaningful outcomes rather than try to boil the ocean.
Excellent. Okay, great. All right, so let's go on to innovation and inspiration. With your experience at the intersection of healthcare and technology, what innovation or changes in healthcare excites you the most right now? And then tell us about the types of innovation that inspire you at Glass Raven.
I think where technology and people and operations meet the best is where it really creates opportunities for coaching,
Mm.
even within a vertical. So a lot of our work right now, because it's not EMR related, especially with new clients, is based on, kind of the call center aspect of patient access.
Okay.
And seeing, that part of the organization. Call centers has a special place for me. I've worked in call centers since high school, starting off at Best Buy. So I know my way around kind of that environment, and it's not where healthcare professionals go. But I say no one goes into healthcare to say, I can't wait to run a call center. And so it's often a very foreign place. They have very foreign metrics that are just not taught, like even in, like master health admin programs.
Right.
It's like, yeah, we're going to talk about service level and abandonment rate and the tech there. So like working there because, you'll often have a team of folks, it's with a lot of healthcare systems and the larger ones, you'll see an us versus them mentality between central scheduling and then a lot of the, offices.
Hmm.
Like they scheduled them at the wrong place. I'm sure front desk staff everywhere have had this experience,
Yeah.
clinician versus front desk. But that frontline desk staff or, the central scheduling team, they can feel disconnected from patient care when they're not.
Mm.
Opportunity to kind of really help them up their game and, be coached and show them how they're part of the, bigger picture and be like, hey, this is what productivity looks like for our team. This is how we're not going to hire 1,000 extra schedulers. We're going to make the schedulers we have, the resources we do, really effective by, again, scraping out a lot of stuff that doesn't matter and giving them, kind of a real stake in the game. And, like, hey, we're going to make sure that supervisors have time to coach you and tell you what we need to do and what we can do better and improve that patient experience, so that patients do come in having had a great front door and they can, share that, because I'm sure everyone has the horror stories of, scheduling was a nightmare. I couldn't be seen for 8 months. I don't know what to do. And that front door staff can feel beat up.
Absolutely.
So being able to kind of, make them part of the care team rather than part of a, care problem,
Okay.
it's an exciting place.
So do you all have that capacity at Glass Raven? Like, do you have a call center solution?
Yes, but as a call centers is one of the only areas of healthcare where it's easy to say what worked over here will work over there.
Okay.
But I say a lot of the math and the logic and forecasting has been around since the invention of the telephone.
Mhm.
So I would say the math there hasn't changed. It's just healthcare. I've seen it globally struggle to apply it
Yeah.
and, really take advantage of it in a way that becomes meaningful for care outcomes.
Mhm.
But I say when we walk into a new organization, we love to start with call centers because we get to skip the EMR integration. That's something we can do down the line to say, not only are we going to see, what are we doing? Is the phone getting answered, but is the phone getting answered? And then are we scheduling an appointment?
Right.
Or, are we just calling in to get directions? So maybe we need a solution for that to lower our call volume. Or, are we calling to be transferred to someone when we should just make that directly available?
You need a prescription refill.
Yes, thank you. Yeah, prescription refills. I have questions about this or that.
Forgot to
It's
ask about.
yeah, a lot, triaging a call, all sorts of stuff.
Right.
A lot of scheduling groups just become the dumping ground for calls.
Yeah.
But getting to skip the EMR integration, yeah, great place to start.
Okay, great. I am dying to ask you a bunch of other things that aren't on here, but I don't want to spin out of control. Okay, so next, let me ask you about this. What is your biggest concern? So you've been in healthcare for how long would you say, ballpark?
Let's see, ballpark, 7, 8 years.
Okay, I mean that's a pretty long time. So now that you've sustained yourself in healthcare, you're thriving in healthcare, you've seen a bunch of different healthcare entities, a bunch of different clients. What do you think is the biggest threat to healthcare right now? What are you most concerned about, especially surrounding technology and data integration?
Yeah, if we're going to talk about threats and technology, I would say there's almost this drive to innovate.
Uh,
And it's like, I think people start throwing around or pursuing solutions before they have identified their problem.
mm,
And things we know about technology, it's not cheap.
yeah.
It's not cheap for money. It's not cheap for time. A lot of organizations, small and big, it's like all their IT resources are going to be built almost exclusively around that medical record system.
Mm,
They're going to be very good at that medical record system. General technology applications may not be their strong suit.
mm,
And so, you'll have Epic analysts or you'll have, analysts for Cerner. And then it's like, oh, we're going to throw in, agentic AI. But I say, the next pitch I hear about an LLM based solution, I was like, tell me about the problem before you tell me about the solution.
yeah,
One of the things we do is like, evaluate, should you do anything?
right, absolutely.
I think, the big word in tech spaces and startups is, oh, we want to be a disruptor. I was like, do not disrupt the provider under any circumstances.
Yeah.
It's like, do not disrupt the front desk, do not disrupt the medical coder. I was like, if you disrupt them and patients don't get served, that's risk.
Yeah.
And it's like, let's make sure that we're going to first identify our problem and then shop.
Yeah.
Let's not take pitches before we've identified what our outcomes are going to be, or we're just going to spend 6 months on a pilot that goes nowhere.
That's a great point. So how do you think people identify like what's your best practice for identifying a problem?
Listen to what people are mad about.
Right.
Just
Agree.
it was like what we're gonna do during these meetings. I was like, I don't care what your technology is.
Gosh.
I don't care, like about all the nitty-gritty details right now. I was like, the technology work is something that I'm incredibly passionate about. The people that buy from me are not. That's why we're talking in the first place.
I love it.
Tell me what your day-to-day is and tell me what is stopping you from doing the things that you want to do.
Mhm.
Questions like, what is your mission and vision?
Yes.
And what are the biggest problems holding you away from that? And then, kind of going down like the classic, like 5 whys. Like, oh, like, I don't feel like I understand the data. I was like, okay, why don't you feel like you don't understand the data? Is it not arriving on time? Is it not arriving in a way that you can understand? Is it too much? But really focusing on those pieces.
Excellent. Okay, great. All right, so let's move on to your bonus question. So with your deep experience in healthcare data, what role do you think data will play in shaping the future of healthcare? And what's one piece of advice you'd give to organizations struggling to leverage their data effectively?
But I said can you repeat that question one more time? I
Let's
think there
go
were 2 parts to it.
first. Yeah, with your deep experience in healthcare data, what role do you think data will play in shaping the future of healthcare?
Yeah, so for that piece, I think people are starting to wake up to the fact that data is not ready for AI in the
Mm,
healthcare space.
great.
Because most often, like I'll go back to one of my favorite things to harp on with vendors is vendors that tell me that they have solved automated scheduling,
Okay.
either online over the phone.
Okay.
And my question for them is often, okay, how do you know what visit type and what provider a brand new patient over the phone is telling you? I was like, how do you know? I was like, is it a new patient or established patient? Does it need to go to cardiology or cardiovascular?
Right.
Um, I think it can sound easy in theory, but
Yeah.
I was like, those rules are written down somewhere, and they are written down in the heads of 1,000 front desk staff, or they're in the heads of a provider if you're a small office, or the office manager. I was like, in order for AI tools to take advantage of that, it has to be digital, and it's not.
Mm,
And this is another place I think product companies solve a problem one place, they go to the next place, it doesn't work.
right.
It doesn't scale because it's like the data is formatted differently or it doesn't exist.
Yeah.
And it kind of hands them back the problem of, hey, you've purchased this solution, but you have to make it work,
Right.
which involves all of this, codification of processes that are currently just very human. It's a very human industry.
Yeah.
And so I think people are discovering that, data is going to have to be put in a space, with a format that, can take advantage of these tools, or we're just going to be left behind. I think it's probably exceptionally a problem for rural areas
Mm,
on, like, hey, these tools are, too expensive and too complicated for us to, put into an individual, single provider practice. And the resourcing, like, the big companies just aren't looking at them because those groups already have no margins to buy, kind of services and products.
absolutely.
So the fancy tools don't really help. And the second part of that question, it was,
What's one piece of advice you'd give to organizations struggling to leverage their data effectively?
so I think people even struggle to understand what using data effectively means.
Hmm.
I think one of the things that is out there is that there is an HR bloat in what an analyst is today.
Okay.
Do we think an analyst is also a data engineer, a data scientist, and a business analyst? And you can probably hear my dog shaking around in the background. I apologize.
Oh,
But I'm gonna say he's rolling. But I think it's really hard to hire for a data role because I don't even think people know what to ask for.
hmm.
I'd say my first role, I was in a project role, but
Okay.
ended up doing some data engineering and business analyst work, all of which is trained differently.
Sure.
And then, kind of the question of we have, an EMR's worth of data, what's meaningful to us?
Yeah.
So I think data is being used effectively if you don't feel like you're working for it and you feel like it's working for you. Which I think looks like, hey, we know what questions we want to ask because they're paired with these decisions.
Hmm. Hmm.
So I think your data is working effectively if you've identified these are the decisions that we can make with data. If you can't answer that question, you need to stop opening up your databases.
Yeah.
You need to decide what decisions can we make and what are our alternative options, and then what data would point us towards one or the other.
Yeah.
Like data point one would say hire, data point two would say coach, because we have no money to hire with.
Mm. Yeah.
So making sure that those questions are asked so that then you can pull the right data. Because if you just start asking questions to analysts, you're paying a salary for people to answer questions that don't drive an outcome.
Mhm. So I want to wrap up with one last question, which I had not anticipated asking you, but you've triggered me now. And this is for my emerging healthcare leaders, which as a professor, I come across frequently. And when you were going through your coursework and, you ended up you said were you an analyst or you were a project?
It was the first role was project specialist before they moved me to be an analyst.
Okay. So, I mean, did you know you were going to be a veterinarian first, you thought, right? And
Yeah.
then MHA, but you end up in a project role and then an analyst. I mean, did you know what role you were kind of going for or going to or going like what advice do you have for emerging leaders that maybe don't know what role they want to go to? And these titles are so confusing.
Yes.
What advice do you give to emerging leaders for where, how do they end up how do they find the role for them in healthcare based on
Yeah.
experience?
So for entry level in healthcare, there's, the spectrum of opportunities is wide, and you're like, I don't know what that is.
Yeah.
Like, you're like, I've studied this now for, 6 years, and I don't know what that job is going to be.
Right.
Because they can be a hyper specialized, that looks like, project specialists, project managers, program managers, analysts. My advice would be ignore the title,
Yeah.
pick a good boss.
Ugh,
Pick a good leader, like someone that interviews that you feel like is going to be your champion and
yeah.
is going to give you space and give you the backup that you need to kind of succeed in that first role. I was very lucky on my draw for my first two bosses. People that were like, hey, it sounds like you understand the space that you can work in. I'm
Yeah.
going to give you problems like that and back you up, let you kind of grow and test and learn. And, honestly, make mistakes, find a boss that will let you make mistakes and then cover for you. Because like one of the first things I did was like email a patient chart to a vendor because it had the same name as like the chief quality officer. And I was like, no, that wasn't supposed to go to that vendor. And luckily they sent it back. My boss was like, it's fine. Never do that again.
Yeah. I love that advice. And the reason I was asking is because I meet a lot of students that, they think they want to be project managers. That title for some reason is very sexy right now. And they keep asking me like, should I get my PMP? And I'm like, you've never been a project manager. You don't even know. I don't know if you're even getting your stuff in on time. And you think you want to be a project manager, you're going to pay for that certification.
Yeah.
What are you doing?
Yeah, like I got my CAPM, the step before the PMP, the associate. I can't remember. It's like certified associate project manager. I've never used it.
Thank you.
I was like, and like there's other things like Lean Six Sigma, where I've seen organizations go down the path of like, let's get everyone certified in Lean Six Sigma, and then they never use it because it's like we weren't focused on how we were going to leverage that. It's like, innovating for innovating, certifying for certification's sake.
That's right.
But I say it's like I think it's much more impressive to speak about what you want to do rather than the certifications that you've pursued. I think people are waking up to the fact that these certifications aren't making people more qualified. But yeah, it's a struggle.
Thank you so much. That was beautiful. I so appreciate that feedback, Peyton. Well, that was on my list of questions. So thank you so much, Peyton, for agreeing to be on the HealthSpark. And I so appreciate your time today.
Yeah, absolutely. This was super fun. Thanks for having me.
So much.
Thanks for listening to the HealthSpark, Igniting Healthcare Management Change and Evolution. Please look out for future episodes and follow us on our social media pages.